Hello there. Now, when will there be a vaccine for Covid-19? That is one of the big questions that you are all asking, I'm sure, or at least discussing with your friends and family. It's a big question for policymakers here in Europe as well, as this deadly virus continues to spread around the world. I'm Catherine Nicholson, and in this edition of Talking Europe on France 24, we are asking a panel of members of the European Parliament when and how European citizens are likely to get access to a vaccine that could allow a return to some kind of normality for all of us. With me here at the European Parliament, I have a panel of 3 MEPs. Starting on my left, we have Christoula Zacharopoulou, who's a French MEP with the Renew Europe group. That's President Macron's group. Thanks for joining us.
Thank you. Nice to meet you.
We also have Marc Botenga from the Workers' Party of Belgium, which is part of the European United Left group. Thank you for being here.
Pleasure.
And we have Bulgarian MEP Peter Vitanov, who's from the Socialists and Democrats group. Hi there.
Hello.
Now, you're all involved in this conversation in your work in one way or another. Mr. Vitanov, you're involved in the Public Health Committee here. You're involved in the Industry and Research Commission, and you are actually a medical doctor yourself as well. So hopefully we should have some input on all aspects of this conversation. The first point, really, the European Commission has been putting hundreds of millions of euros on the table, wanting to secure 300 million doses of vaccine. Just coming to you first, Ms. Zacharopoulou, how much faith do you have in these procurement schemes that they will come up with viable vaccines and in the quantities needed for European citizens?
You know, I hope, first of all, that we can find this, we can develop this vaccine early. Because you see the impact, the economic and the social impact that has this coronavirus crisis. So it is very nice that the European Union make the negotiation at the name of all the member states. And this is a big victory, first of all, for Europe. And of course, we have some laboratories that is in phase 3. That means we have some hopes, and I hope that these hopes can be realized. Of course, once we find the vaccine, we have other challenges, because we have also to be sure that the raw material are enough. The guarantee of the European Union has to be this. And 2 is where will be product. The site production is also a big issue. So I just give my global opinion, if I can say.
Absolutely. Marc Botenga, do you believe that this time frame the European Commission has talked about of 12 to 18 months, is this a realistic ambition?
It's to be seen. I mean, it all depends on how the vaccine development really goes. I mean, there's not a fixed timeline. Some of us promised a vaccine for the autumn of this year. That's clearly not going to happen. Now, what I'm wondering with these deals of buying up potential candidates for a vaccine, so there is no vaccine, but we're already buying potential candidates, I think that there's a big risk, and that is that we might be paying 3 times for the same product. The European Union has been sponsoring research and development of this vaccine. Now we are pre-buying the vaccine, so we're paying these companies money at the cost they present. And finally, and this is something which is very worrying, which has come out last week, that there might be a civil liability waiver in these contracts. What does that mean? That means that if in 2 years, 3 years, 4 years from now, there would be negative consequences, side effects of this vaccine, that in the end, public authorities would be the ones paying for the damages suffered by a patient. Now and this is why we're calling on the European Commission to publish these contracts. Because if this clause is in the contract, then basically we are paying 3 times for a vaccine, and that would be terrible and unacceptable, really.
Peter Vitanov, how confident are you about these vaccine programs?
Well, to be honest, generally it takes, but we have a medical doctor here who can probably confirm it takes 10 years to produce a vaccine, and going to a time frame with 12 to 18 months, it hides a lot of risks, to be honest. But vaccines is just part of the issue, part of the health issue, because this corona crisis in the very beginning proved that the European Union is not ready. And to be ready, European Union, for such a crisis, it has to create some kind of a health union. With public procurement is one of the issues there, and common public procurement can guarantee an adequate price for all the countries, and it will avoid the competitiveness between them. But setting a minimum standards and giving the opportunity for treating patients abroad and giving money for the health in general, more money, it will definitely improve this fundamental right, what the health is.
I'd like to pick up on that point you said about the European Union not being ready. Do our other members of the panel agree with that? And could this be a starting point for a different take on public health in the European Union? Chrysula Zacharopoulou?
It was not ready. If we can see also until now, the European Union had not, it was not the Europe of health, we can say. It is a national competence. This crisis showed to us that there are issues, and I think it's the first issues because, as you told me, like a doctor, I will tell you that there are many challenges that we will face all together. For example, the neurodegenerative disease that are increased, that this population, Europe is an old population, and so we have a lot of chronic disease. So it is an opportunity, and is what the European Parliament, with the resolution, we pushed to have a Europe for health. The problem is that in the recovery plan, we were waiting a lot of money for health, and now actually we have zero. So this is a question that if we want to have a Europe of health, we have to push, and this is our role.
I'd just like to pick up as well on the issue of how quickly this is being developed. As Mr. Vitanov said, usually takes about 10 years to produce a viable vaccine. Ursula von der Leyen talked about speeding up bureaucratic processes.
Yes.
That didn't give much detail. Should we be worried about the speed of this vaccine? Should people be concerned about whether it's going to be perhaps maybe not damaging to their health, but perhaps not helpful to them?
I think that when we want to go faster, we see that there are many bureaucratic things also in European Union. And I think that this is the steps that we can, pass through.
What kinds of steps?
For example, we have to ask every member state if it is okay. We have now a negotiation, for example, for the European Union, so it is easier. We don't have 27 that speaks. We can, for example, we can say that we don't test to the children, so we can gain time. We can say we are not going to make traduction and it's true this, in all the languages at the beginning, we use one language, and at the scientific point of view, you cannot go fast.
Okay.
No, yeah, I think there's at the scientific level, we need to respect all the safeguards because you don't want, there's many people that are afraid of vaccines, that are afraid. And, these considerations, you need to take them seriously. And this can only be solved by absolute transparency as well.
And if not enough people take the vaccine because they're worried about these concerns, then it means the vaccine isn't very effective. You need a certain amount of the population to take them, don't you? So they do need to be reassured.
Absolutely. So, you need transparency on this. And this is why I regret it so much that much of these negotiations go on behind closed doors, that we don't have access to the information. Because if you want to reassure people, you need this transparency on the one hand. Secondly, and I was positively surprised when the chairwoman of the Commission came to Parliament, I think in March or April, and when she said, well, this vaccine should be our universal common good, meaning it should belong to all of us. And I think this is an important thing as well, to show we're not going to just sell it out to one company. It's not going to be a monopoly or privatization, let's say, of the vaccine, but there's going to be democratic control on this, and that is absolutely fundamental.
And perhaps one important point just to bring up, because we've got a little bit of time left, about the cost of this vaccine to European citizens. No one's able to say exactly how much these vaccines would cost right now, and there are massive differences in income levels across the member states. Luxembourg average monthly wage over 3,000 euros. In Bulgaria and Greece, it's 1,500 euros. Peter Vitanov, should there be some levelling of pricing? What should be talked about on cost?
Well, definitely it should be because, like I said, it's a fundamental right, and this public procurement will help to have this vaccine on a fair price, despite the size of the country, despite the income of the country. I believe that it must be accessible. This is a must.
Other members of the panel?
You can make it happen. You know, if you fund, with the European Union, we fund the research and the development of something, you can add these conditions, saying we want it at production cost. And then it can be actually free to the patient. Social Security will cover the production cost. But this can be happen. But this requires the European Commission to introduce these conditionalities in the research and development contracts it concludes with these companies.
At the end of the day, it is, of course, a
I
political
totally agree.
decision.
I totally agree with you.
All right, consensus on our panel, at least. Have to see what the politicians who are making those decisions come up with. Thank you all very much for taking part in the discussion. We'll, of course, have to wait and see if any of these vaccines do come up with something viable for European citizens to use. Still plenty of work to be done. Thank you all very much. Chrysula Zakharopoulou, Mark Betenga and Peter Vitanov.
Thank you.
Pleasure.
Thank you.
Thanks to you for watching, and hope to see you soon on France 24 for more European news.
France 24. Every art form.
Liberté, égalité, actualité.